And again, let's try and think of some muscles at each joint that we should screen. So what I'm going to do, if you could bend up at your hip for me and keep your leg up in the air like that. Don't let me push your thigh down now. So that's hip flexion. She does that very well. Let's rest your leg. Let's check on the left side. Hold it up there for me. Don't let me push it down. And that's strong. Now, could you keep your knee bent again? Don't let me pull out at your knee. This is knee flexion. Okay, put it down. And we'll bend your knee here. Check knee flexion here. Very strong. Now let's push out, straighten out your leg, push out against me, kick, and that's knee extension. And same thing with this leg. Bend it for a minute, and now kick it out straight for me, and the knee extension there strong. Now we're going to look at the ankle joints. And what I'd like you to do, can you just bend your foot up at the ankle here? Don't let me push you down. Okay, relax. And bend up this guy. Don't let me push you down. And coming back here, I want you to push down like you're stepping on the gas. Very strong. And same thing here. Very good. Okay. In the motor examination, muscle strength or power is graded on a scale of 0 to 5. 0 is the worst, meaning no visible muscle contraction or movement at all. Next is 1, where if, for example, we're testing strength in the right deltoid muscle, and I ask the patient to abduct at the shoulder, as I'm looking with a grade 1, I might see a little twitch or flicker in the deltoid muscle, but I really don't see any gross movement of the limb. That would be only a grade 1 at best. A grade 2 would be if the patient can move the muscle with the effective gravity eliminated. In other words, they're weak, they could move the limb without having to lift the limb up against gravity. So when lying supine in this horizontal plane, a best responsive grade 2 would be for the deltoid if the patient can just abduct at the shoulder in the plane of the exam table and not against gravity. That would be a grade 2 with the effective gravity eliminated. And now we're going to sit up to show the other muscle grades. You sit up for me. So again, we're checking the right deltoid. Now, grade 3 would be she can abduct. Now she's lifting the limb against the effective gravity. Okay. And that's the best she could do. A grade 4 is nearly normal, where she can not only abduct the upper limb against gravity, but give me some resistance, but I can overcome it. And the best strength, grade 5, would be she holds the limb up against gravity, and with all my power, I cannot overcome that muscle. That's totally normal, grade 5. And again, you could be grading the muscles and looking for asymmetry from side to side. The next item we're going to test are the reflexes, the muscle stretch reflexes. So I'm going to grab my reflex hammer again. And we could be testing the patient as she's seated. Actually, it's probably a little better when we're supine like this because the patient is not going to be slouching or leaning in one way or the other, which could sometimes cause an asymmetry in the reflex exam that may throw us off. So can you just put your hands on your tummy here for a minute? Okay. So we're going to look at the upper limbs first. So for the biceps reflex, just try and go limp and loose. I'm going to be tapping on your reflexes gently with my hammer. I'm going to put my thumb on her biceps tendon. You could also use your index finger if you'd prefer. And I'm tapping on my thumb to see if I can elicit arm flexion here. And sometimes I could feel it more than you can see it. Okay. I'm just lean over you a second. I'm going to do the same thing over here. I'm putting my thumb on the biceps tendon and tapping on my thumb, and that's a nice symmetrical biceps reflex. The other one I could check is the triceps reflex. So if I could just gently hold your arm here, and I'm going to tap just above the olecranon, and I'm going to look for extension at the elbow, just like that. Rest that down. Drape this one over your chest, and I'm going to tap over here again. And that's nice extension at the elbow. The other reflex is the brachioradialis reflex, so I'll be tapping near the distal head of the radius bone to see again if there is flexion at the elbow. And there it is. And there it is over there. Now we're going to move on to the lower limbs to check the muscle stretch reflexes here. We're going to look at the knee jerk or patellar reflex. So I'm just going to gently support underneath your knee and tap just below your knee. And I'm going to look for a kick or a knee extension. Here we go. And that's a very good one. Gently behind here too. And that's nice and symmetrical. That brings us to the ankle reflex. So in the supine position, I'm going to gently rotate at the hip and get into this position. And I'm holding the foot here near the toes by the ball of the foot just to put a little tension on the Achilles tendon in this position. I'm dorsiflexing a little bit. I'm going to tap right by your ankle. And there's a beautiful ankle reflex. And then I'll get on the other side and do the same thing. I'm going to rotate at the hip, pull up behind the knee, and I'm putting a little passive dorsiflexion here on the foot. And there's a nice ankle reflex there. Now, while we're at the feet right now, this is the perfect time to check for a Babinski or a abnormal plantar response. And what one can do is take a blunt object, and often it's a key. What I'm going to do now is I'm going to just tickle or scrape the bottom of your foot, okay? Just bear with me. And I'm going to start near the heel, and I'm going to gently scrape with my key along the lateral sole across to the ball of the foot. And the Babinski would be a slow upward movement, a dorsiflexion of the great toe, and maybe a fanning of the little toes. With ticklish people or a normal response, there may be an abrupt, quick withdrawal, or it could be a curling up of the toes. I'm going to do this here. Here we go. I don't see any response there, so there's no abnormal plantar or Babinski response. And we're going to do the same thing on this side. And there's no response there. So that's fine. An alternative position to check the muscle stretch reflexes is with the patient seated on the exam table. Although, again, if the patient is slouched or leaning on one way or the other, it may enhance reflexes on one side of the body versus the other side and mislead you into thinking that there's an asymmetry and that there's something abnormal when in reality it's just the position of the patient. But while the patient's seated here, let's show a close-up of the reflexes, and you could better see the positioning you would use for the different stretch reflexes. So if we're going to test, again, the biceps reflex, you want to palpate the biceps tendon here. If you have a little trouble in certain people palpating it, you could perhaps have them bend up at the elbow here. And that really brings out the tendon there. Okay, you can relax. So I'm putting my thumb there, or some people like to put their index finger right on the biceps tendon, and then I'm going to tap on my thumb and look for arm flexion as the response. And then likewise, you want to go to the other side and kind of position the arms similarly. Put my thumb on the biceps tendon. And there's arm flexion on that side. The next reflex would be the triceps reflex. And now in this position, we could perhaps do it in two different ways. One way would be to just drape the arm across the chest, which is the way I was doing it supine, and tap on the triceps tendon just above the elbow or olecranon right here, and look for arm extension at the elbow. Then likewise, same way over here. And she's being nice and loose and relaxed here, which is what we really want. And I'm tapping again on the triceps tendon and get a nice symmetrical reflex.